We're used to thinking that more checkups mean better health, that undergoing every type of test is a sign of self-care. But what if I told you that after a certain age, those very same screenings could become a real risk to your health? It's a counterintuitive reality, one that's hard for many to accept, but it's gaining more and more attention in the medical world. As we age, the body changes, physiological responses are altered, and what was once helpful, safe, or even life-saving can turn into something counterproductive. If you also want to live every phase of your life with awareness and dignity, write in the comments, "I take care of myself with intelligence." And don't forget to hit the like button, subscribe to the channel, and turn on the notification bell. Every video is designed to guide you on a path to authentic, non-invasive health. Today I want to walk you through a line of reasoning that is as important as it is overlooked. Many diagnostic tests, especially for patients over 70, can not only be useless, but are sometimes downright dangerous. There are routine tests, often presented as mandatory, that lead to stressful and expensive cascades of unnecessary medical events, triggering a cycle of fear and treatment that can worsen your quality of life more than it improves it. This isn't about being anti-medicine. On the contrary, it's about championing a wiser, more personalized medicine that respects the journey of aging. One of the first exams I want to focus on is the colonoscopy. For decades, it's been considered the gold standard for preventing colorectal cancer. And it's true. In adulthood, especially around ages 50 to 60, it can indeed detect precancerous lesions and save lives. However, once you cross the 70-year-old threshold, this same procedure changes its nature. In the absence of symptoms or a direct family history of the disease, a colonoscopy can prove to be more of a burden than a benefit. Why? First, the required prep is very demanding. It involves completely emptying the bowel through an intensive cleansing process, which can cause severe dehydration and electrolyte imbalances in older patients. For those who are frail or already living with other chronic conditions, these can become dangerous. Furthermore, the sedation, which might affect a young person for a few hours, can have a prolonged effect on an aging body, causing mental confusion, impaired balance, and an exponential increase in the risk of falls. Then let's think about what happens after the exam. A colonoscopy can detect even the tiniest polyps, many of which are benign and grow very slowly. Yet, the mere discovery of an abnormality often triggers a sequence of new tests, biopsies, removals, and post-op checkups. All of this for growth that in many cases would never have caused a real problem within the person's lifetime. I always think back to the case of Mr. Giorgio, an 82-year-old man, vibrant and fully independent, who decided to have a routine colonoscopy. He had no symptoms, no family history, but was convinced by a doctor to proceed just to be safe. During the prep, he lost a lot of fluids and felt weak. After the sedation, he was left confused and disoriented. That same night, he fell at home. The result? A fractured hip, months of rehabilitation, and a loss of his independence. And do you know what the colonoscopy report said? No polyps, no lesions. Nothing. This is what it means to honestly reevaluate our choices. It's not about distrusting doctors, but about questioning what truly makes sense at an age where quality of life matters as much as, if not more than, its length. The one-size-fits-all approach that works for a 40-year-old cannot be applied wholesale to someone who is over 70, 75, or 80. Fortunately, today there are alternative tests, simple stool analyses, for example, that can provide valid and less invasive information on the risk of colon cancer. These are gentler, more respectful tools for the body, but just as effective when used judiciously. The second controversial exam is one that fascinates many for its promise to see everything, the famous full-body scan, a complete map of our body obtained in minutes thanks to a CT scan or MRI. Sounds reassuring, right? In reality, for people over 70, this type of screening can become a trap, not because of the technology itself, but because of what it finds, or rather what it seems to find. These high-precision scans can identify every tiny detail, nodules, calcifications, small shadows, insignificant alterations. The problem is that not everything that's found has clinical significance. Many of these incidental findings are harmless, stable, and asymptomatic. But as soon as a doctor sees them, protocol dictates further investigation. And so the vicious cycle begins. Specialist visits, more scans, biopsies, and in the worst cases, surgery. All for a lesion that probably would have never turned into a real problem. A classic example is the case of Mrs. Betty, 78, vibrant, independent, with no health issues. At a local health fair, a mobile clinic was offering discounted scans. Don't miss the chance to get a head-to-toe checkup. She accepted. The machine found a micro-lesion on her kidney, millimeters in size, with no clinical signs. But the word lesion is scary. Betty found herself in an operating room, facing surgery, weeks of recovery, and a loss of energy. Her health didn't improve. In fact, from that moment on, her life changed radically, all for something that, in all likelihood, would have never required intervention. This is called overdiagnosis, finding problems that aren't really problems. And while a young adult's body might easily recover from a useless surgery, for an older person, every procedure carries a high risk. Even lying still for half an hour in an MRI machine can be difficult, even painful, for joints worn by time. And the anxiety triggered by an ambiguous report is no less dangerous. It causes insomnia, fear, and frustration. All of these things erode peace of mind, increase the use of medication, and worsen one's quality of life. On top of all this, there's another aspect, the cost. Full-body scans are rarely covered by insurance, and many seniors, driven by fear, end up paying out of pocket for exams that are not only useless, but can set a harmful spiral in motion. Often they aren't buying health, but just anxiety and uncertainty. In this stage of life, responsibility takes on a different form. It means having the courage to say, no, thank you, when something doesn't align with your true well-being. It means learning to listen to your body, not just the machines. And it means recognizing that our worth isn't measured by what a scan can detect, but by how we live each day. Let's continue this journey into the world of medical tests that, as we age, can shift from tools of prevention to sources of risk. After exploring the cases of the colonoscopy and the full-body scan, it's time to focus on another exam that for years was considered the gold standard for monitoring the heart, the cardiac stress test. Anyone who has ever put on a pair of sneakers in a doctor's office and walked on a treadmill while hooked up to electrodes knows this test. The goal is simple. Put the heart under stress and watch how it behaves. A logical, seemingly sensible idea. But when we're talking about older patients, this logic starts to crumble. The stress test was designed to identify ischemia, coronary problems, and latent arrhythmias. But in the body of a person over 70, physiology changes dramatically. Arteries become stiffer, the heartbeat more variable, and blood pressure more unstable. Essentially, an older person's heart responds differently to strenuous physical activity, and the results obtained under these conditions often don't reflect real cardiac problems, but rather the natural adaptations of aging. The risk? The notorious false positives. What does false positive mean? It means the test indicates an abnormality where there isn't one, and when you receive a suspicious report, the domino effect begins immediately. New tests, echocardiograms, angiograms, cardiac catheterizations. In some cases, it even leads to the insertion of coronary stents, tiny metal tubes in the heart's arteries, to prevent future events. But if the initial problem wasn't real, this entire chain of events can have consequences far more serious than the supposed initial risk. We must also remember that every medical procedure, especially invasive ones, has a biological cost. For a young person, a test with contrast dye might just mean a day of feeling tired. For an older person with reduced kidney function, the same dye can cause acute kidney failure. A catheterization can lead to bleeding, adverse reactions, or complications at the vascular access site. And it's not uncommon for an older person, after a theoretically minor diagnostic procedure, to end up hospitalized with a clinical picture more serious than the one they started with. Then there are the psychological costs. Feeling like you have a heart condition just because of a flawed test can completely change your self-perception, leading you to limit daily physical activity out of fear, increase medication intake, and trigger a vicious cycle of anxiety, sedentary lifestyle, and loss of independence. In other words, a cardiac stress test, if performed without a real clinical indication, can do more harm than good. Leading geriatric and cardiology societies are saying it clearly today. The stress test is not recommended as a routine screening for asymptomatic older adults. If there are no obvious signs like chest pain, unexplained shortness of breath, or abnormal fatigue, the benefit is practically nil. The risk, on the other hand, is real. So what can we do to take care of our hearts without taking unnecessary risks? The answer is surprisingly simple. Get back to basics. Walk every day, maintain a diet rich in fiber and low in saturated fats, sleep well, reduce stress, and cultivate loving relationships. These elements, not wires attached to your chest, are the true medicine for the heart, especially in our later years. A heart cared for with love, balance, and active listening needs less technology and more humanity. I often tell my patients, we don't live to pass tests, we live to live well. And living well after 70 means not subjecting the body to pointless strain, but protecting it with wisdom, thoughtful choices, and a new awareness. This brings us to a broader reflection. Aging is a natural process, not a disease to be fought with an arsenal of diagnostic machines. And every test must be evaluated in light of a personal balance, not a universal standard. After a certain age, the risk isn't just the disease itself. It's the risk of excessive medicalization. It's the idea that every small variation, every anomaly, every out-of-range number must be corrected, treated, eliminated. But sometimes the real cure is to leave alone what isn't bothering us. That's why we need a shift in mindset, both in patients and doctors. It's not about doing less to do less, but doing better to live better. For this reason, every time you're offered a test, ask, will this test change anything in my life? If the answer is no, if it won't lead to a treatment that genuinely improves your quality of life, then perhaps it's time to decline. This isn't disinterest, it's clarity. It's not shallowness, it's respect for your body and your time. Your years shouldn't be spent in clinics, but on slow walks, in chats under the sun, at dinners with friends, enjoying your interests and with your loved ones. That's where health is measured, not in the numbers on a report. Remember, not every diagnosis is a solution, and not every silence from the body is hiding a disease. Often it's just peace. We've reached a crucial point in this reflection, understanding that it's not the number of tests that guarantees a long and healthy life, but the quality of the decisions we make. And often, the wisest decision is to not undergo unnecessary tests. After talking about colonoscopies, full-body scans, and cardiac stress tests, I now want to guide you through another grey area of modern medicine: excessive prostate screening in older men and routine mammograms in women over 75. Let's start with the PSA test, the blood test that measures prostate-specific antigen. It's a tool that revolutionized the early detection of prostate cancer, but over time it has revealed itself to be a double-edged sword. Yes, because while it's very sensitive, the PSA test is also terribly imprecise. Levels can rise for completely benign reasons, like a simple inflammation, recent sexual activity, or even a longer-than-usual bike ride. Yet when that number comes back even slightly elevated, the alarm bells go off immediately. The patient gets a call, the doctor recommends further tests, and the mind panics. This starts a journey of biopsies, invasive exams, and in many cases leads to a prostatectomy, the surgical removal of the gland. Now let's pause for a moment. A significant percentage of prostate cancers are extremely slow-growing. So slow, in fact, that many men over 75 will die with the cancer, but not from the cancer. We're talking about carcinomas so indolent that they might not require treatment for decades. But as soon as they're discovered, emotional pressure and medical protocols often push towards surgery, and that's where the real risks begin. A prostatectomy very often leads to consequences that drastically change one's quality of life: urinary incontinence, erectile dysfunction, pelvic pain. For what? For a lesion that, in many cases, would never have caused a problem. For a cancer that would have remained dormant. I'm reminded of the case of Paolo, 76, a serene man retired for a few years who loved gardening. He was offered a PSA test during a post-retirement health screening. The value came back slightly elevated, from there a biopsy, then an MRI, then a diagnosis of a microcarcinoma. No symptoms, no discomfort, but just knowing he had a tumour was enough for him to agree to surgery. The post-op recovery was long and complicated, and from then on, Paolo was never the same. Incontinent, depressed, withdrawn. He had lost his freedom, his joy, his lightness, all for something that perhaps never needed to be treated. This is why many geriatric associations now advise against routine PSA screening in men over 70, especially in the absence of symptoms. Medicine must adapt to the patient's age, life context, and goals. It's one thing to monitor a 50-year-old man with a strong family history of prostate cancer. It's another to propose repetitive tests to an asymptomatic older man who has every right to live the last decades of his life without the burden of suspicion, anxiety, and unnecessary medical complications. And the same goes for mammograms in older women. This exam has had an extraordinary positive impact on the prevention of breast cancer. But here too the problem arises when it's automatically offered to all women at any age without personalizing the assessment. After age 75, the benefits of mammogram screening diminish, while the risks associated with false positives, unnecessary biopsies, anxiety, and surgery for tiny lesions that might have remained silent forever increase. Take the case of Maria, 79, who had always diligently undergone her scheduled checkups. An annual mammogram revealed a suspicious microcalcification. No lump, no change she could feel, but protocol dictated a biopsy. The result was uncertain. A lesion of undetermined significance. Her doctor advised, out of an abundance of caution, a lumpectomy. The surgery, besides the physical pain, left her with a deep emotional scar. She no longer felt like herself. The final result, the tissue was benign. There was no real need to intervene. This is why, after age 75, the decision to continue with mammograms should be carefully considered on a case-by-case basis and no longer be seen as a routine obligation. The goal always must be to improve the quality of life, not to chase down every possible suspicion to its extreme conclusion. Because not all cancers are the same. Some are aggressive and must be treated, of course, but many others, discovered at an advanced age, are indolent, stable, and can simply be monitored, allowed to coexist with the person without bulldozing its way into their daily life. This is the difference between automatic medicine and human-centered medicine. The first follows rigid guidelines. The second listens, evaluates, and dialogues, and above all it respects. It respects the aging body, it respects the rhythm of life, and it respects the person's desire to live well, even at the cost of knowing less. There's a phrase I often repeat to my patients: after a certain age, less is more. Fewer tests, more listening. Fewer alarms, more serenity. Less technology, more quality time. Because the truth is, at a certain point, the best medicine isn't the one that tries to prolong life at all costs, but the one that knows how to cherish it in the present. Why insist on exams that risk bringing only anxiety, side effects, and complications? Because we have internalized the idea that prevention means doing everything, always, no matter what. That's not what prevention is. Prevention means acting with common sense, choosing only what has a real chance of improving our condition. And above all, it means letting go of the idea that every change in the body must be corrected. Aging is not a mistake. It is a natural process, and as such, it deserves respect. The same applies to many routine ultrasounds offered without reason, to overly frequent blood tests, to comprehensive checkups that become labyrinths from which it's hard to escape. Every new piece of data can become a new problem, and every problem a new procedure, until we forget why we underwent the test in the first place. That's why it is essential to put the person, not the report, back at the center. The meaning, not the result. The lived life, not the diagnosis. In this section, we've touched on extremely common tests that are often offered automatically, even when they're no longer needed. The message is not to distrust medicine, but to demand a smarter, more respectful, and more person-centered medicine. Because what truly matters is not discovering every potential disease, but living every day to the fullest. Once you cross the 70-year threshold, health becomes something deeper than just feeling good. It becomes the ability to stay present in your own life, to still feel like the protagonist of your own time, to choose with awareness. And it's right here that one of the most important yet underrated truths of modern medicine comes into play. Doing more isn't always better. In fact, in many cases, it's by doing less that you gain more. More peace, more autonomy, more quality. This is the central point of this entire discussion. Health is not the same as diagnostic overkill. In fact, after a certain age, health is synonymous with intelligent choices, with the ability to distinguish between what is useful and what is simply protocol, with the courage to stop and ask, will this test truly improve my life, or will it just complicate it? Many of the tests we've analysed, from the colonoscopy to the PSA test, from full-body scans to mammograms and stress tests, are often proposed automatically, without a real assessment of the individual's context. But a human being is not a machine, and aging is not a disease. At 75, 80 or 85, what truly matters is no longer discovering every tiny anomaly hidden in the body, but ensuring that every day is lived with meaning, dignity and freedom. This brings us to a key concept that should be as much a part of the medical vocabulary as diagnosis or cure: proportionality. Subjecting an older person to a test only makes sense if the result can lead to a concrete and beneficial therapeutic change. If knowing something doesn't improve the course of their life for the better, then it's not useful knowledge. It's just a burden, just noise. Think of all those abdominal ultrasounds repeated every year without any clinical indication. Those blood draws with 20 different values for patients who feel perfectly fine. Those generic, often expensive checkups that serve the seller more than the recipient. Every time one of these tests highlights an abnormality, no matter how small, a door opens. Behind that door are new analyses, new specialists, new tests, sometimes even surgeries. But often that door doesn't lead to a real solution, but to an endless hallway of worry, doubt, and superfluous treatments. In gerontology, there's growing discussion around a key concept: iatrogenic risk. That is, harm caused not by the disease, but by the treatment itself. And in advanced age, iatrogenic risk becomes extremely high. Every medication can interact with others. Every test can be stressful. Every hospitalization can reduce autonomy. Every anesthetic can leave a mental fog for days. And every surgery involves a recovery time that at a certain age becomes increasingly precious. Let's remember, we don't get older to remain under observation, but to live according to our own rhythms, values, and desires. Good geriatric medicine isn't about chasing everything, but about choosing what's truly worth chasing. Not everything that can be done should be done. And this is a lesson in maturity, for patients as much as for doctors. And yet many older adults struggle to say no to a test, because they're afraid, because they feel guilty, because they've internalized the idea that not doing something is a form of self-neglect. But it's just the opposite. Saying no to a useless test is an act of self-respect. It's affirming the right to live well, not just to live longer. It means stopping the chase after hypothetical diseases and starting to build real health, the kind based on sleep, nutrition, movement, social connection, and emotional balance. So how can we protect ourselves from this hyper-medicalized trend? The first step is a change in mindset. Understand that the absence of symptoms in an older body isn't a ticking time bomb that must be diffused at all costs, but a sign of balance that should be respected. The second step is to learn to ask your doctor the right questions. Can this test really change anything about my treatment plan? Is it truly necessary since I don't have any symptoms? What happens if I don't do it? If the test comes back positive, what would that mean for me? Do the benefits outweigh the potential harms? A good doctor should welcome these questions, not as a sign of distrust, but as proof of active participation in your own health. It's time to transform the doctor-patient relationship into an adult, mature, shared dialogue, where the patient is not a body to be examined, but a person to be accompanied. There is nothing more powerful than a senior who knows how to say, "I don't need this." It's a revolutionary act in an era that wants us to be eternally monitored, catalogued and measured. It's an act of freedom and intelligence. It's a way of reclaiming your own life, of breaking free from the tyranny of diagnosis at all costs. And above all, it's an act of self-love, because every useless test avoided is time gained. Time to spend with a grandchild, with a book, with music. Time to be lived, not treated. If you've made it this far, it's because you feel this message resonates with you. So we ask you for one small thing. Leave a comment below and share one thing you learned today that you'll put into practice in your life. Your thoughts give us strength and inspiration, and they help others feel less alone in these difficult choices. And if you found this content helpful, please give it a like. Subscribe to the channel and hit the notification bell so you don't miss our next videos. Your support makes a difference. If you want to support this project directly, you can also do so with a small contribution by clicking the Super Thanks button right below the video. It's a simple way to help us continue producing independent, serious content that respects your time and your intelligence. Thank you for joining us on this journey. We hope that from now on, you'll look at medical tests with different eyes, not with fear, but with judgment. Not as obligations, but as tools to be evaluated. Because you are the one who knows your body, your mind, and your idea of well-being better than anyone else. You have the right to choose, to say yes, but also to say no. With respect, with courage, and with the awareness that living well is worth so much more than just living long.